Hi! Breaking news! Tampa General Hospital has just received magnet status for the 6th time in a row. We're here at Tampa General celebrating this great accomplishment. And today, for the guest speaker, we have Michelle Disler, who is going to discuss the quality improvement project that was performed at Tampa General Hospital Transplant Unit to improve patient fall rates. Here she is.
Hi, Julie. Thank you so much for that great introduction. We here at Tampa General are so excited about this magnet status. I want to introduce to you what we did here at Tampa General on the transplant unit. It was a QI project that had an overall focus to reduce the patient falls on a transplant unit. The presentation that I'm going to do is going to cover a reflection on the process of the QI framework, the project implementation and logic model, and the project site. So the PICO for this project, QI project, was for an inpatient transplant unit experiencing high fall rates. How will the implementation of evidence-based practice of the AHRQ fall prevention program compared to the current practice affect the transplant unit fall rate over 8 weeks? Some of the patient safety issues within the fall rate is that a fall is any unplanned descent to the floor with or without injury to the patient. Falls can have a negative impact on patient, families, and the healthcare system. They can result in decreased quality of life, reduced independence capabilities, and can possibly result in death. Falls can result in prolonged hospital stays and increased patient cost. The importance of the fall rate indicator is that fall rates is identified on the JCAHO National Patient Safety Goals and National Database of National Nursing Quality Indicators as a critical indicator for quality care. The patient falls has been identified as a National Database of Nursing Quality Indicators as a critical indicator and is incorporated into the standards of a magnet status. Organizational priorities. Patients are affected with high fall rates. Falls can have a negative impact on patients, families, and can really reduce quality of life and independent care. Falls can put an unexpected strain within the community and taking care of the patients. Internal evidence of patient safety. The quality improvement project at Tampa General Hospital identified an increased fall rate over the past 6 months on this transplant floor. A gap analysis was performed through the PDSA framework that indicated a benefit from the AHRQ fall prevention program and initiating the Morse fall scale assessment along with universal fall precautions and implementing a fall prevention patient education program. Then we implemented the educational aspects of these 2 parts of the implementation plan, and we did a study of the overall effect of these 2 implementation aspects and did a post-implementation audit to identify any strengths or weaknesses, areas, opportunities for improvement. Then we did analysis on the overall project and any areas that we can change to continue the improvement on the floor. So the project implementation plan incorporated nursing education on the Morris Fall assessment and universal fall precautions. This used an educational storyboard and nursing instructional seminars, along with new nurse orientation components that focused on the fall initiatives. Then we developed a fall prevention patient education flyer that's given to patients during admission and reused a teach-back method incorporated into the AHRQ fall prevention program. With this, patients need to understand and reiterate to nurses and the staff why they are at risk for fall and what they can do to help prevent their own fall. So, the next component of this presentation is just going to cover the project site. Tampa General Hospital is a world-renowned hospital with level 1 trauma center. It has been known for its academia and also receiving this great magnet status for the last 5 consecutive times and now going on to its 6th. My preceptor is the VP of Patient Care Services. She has been with the organization for over 20 years and has been a very good resource. And lastly, the transplant floor manager and the Tampa General Hospital Fall Committee team have been excellent resources in educating me on practices within the organization. So overall, I can say I have had a great opportunity in this QI project. Thank you.
Hi, thank you so much, Michelle, for sharing that information and how the Quality Improvement Project, reducing patient falls on the transplant unit, reduced the overall patient fall rates for that unit. That, incorporated with many other aspects, helped Tampa General Hospital achieve this fine status once again. Thanks, bye.